I expected was going to be a sort of discussion of the pros and cons of treatment as prevention. And it's a little bit like you know, discussing is ice cream great or is it good? We could have had just as persuasive a presentation of slides and data that would have raised a lot of questions about things like the development of resistance and the possibility of ruining a very effective drug 3, 5, or 7 years out with the development of resistance. We could have had presentations on the toxicity and what it means to be giving a drug that causes irreversible kidney damage in people. We could have had a presentation on what it means to people with HIV to hear about treatment as prevention when we can't get treatment because we need treatment. That very phrase is an insult. That phrase puts our lives, our health, as secondary. It contributes to the further demonization of people with HIV and seeing us solely through our potential to transmit a virus, as viral vectors, as potential infectors. Dr. Montaner, in British Columbia, the implementation has resulted in all sorts of concerns about ethical issues around confidentiality, coercive testing. I'd like to hear the doctors respond to the real controversies about treatment as prevention. Not just talk about all these wonderful, you know, utopian visions. We have had an epidemic today because we have ignored the human rights concerns. For 30 years, they've been secondary. And right now, where we're talking about, oh, an end to the epidemic and all this rah-rah messaging that has been sort of slammed down the throat of everybody involved in the epidemic, and people who have had a different view have been silenced. We are, again, putting the human rights concerns secondary, and we are creating a problem that that we could avoid if we would put the human rights concerns first, which is not what has happened with the treatment as prevention discussion.
Julio.
It is not possible to give you a comprehensive review of our experience in 10 minutes. And I would like you to know that I agree with you 100%. And if you read the editorial I wrote in The Lancet last year, I entitled it, Treatment as Prevention, a Hat Trick. Prevents morbidity, mortality, and transmission. This is not about preventing transmission. This is about securing the treatment, and I phrase it very clearly every time that I said it. This is about treating the people that need treatment, implementing the guidelines that are currently available, and deriving a secondary benefit on prevention that is a side effect of doing the right thing for the people that need treatment. And I'm going to remind people here why we started this campaign. It was because my Deputy Minister of Health called me in the 2005 year to tell me that they were going to put quotas on the access to treatment because I was treating too many people and it was becoming too expensive. And that's when I said to her, you are making a mistake. The best way to slow down this epidemic is to do the right thing for the people that are infected. And let me reassure you that we have done this in a very highly ethical environment where we have been at the forefront of fighting the federal government for the right of the most marginalized people, including taking them to the Supreme Court of Canada to keep this supervised injection site open in Vancouver so that we can have access to low-threshold facilities for people who use drugs, just to give you an example of it. So I agree with you 100%. We are not about coercion. We are not about mandatory anything. We are saying that the treatment should be made available to those that want it and need it. If we do that, there will be a secondary benefit in reducing transmission. And I use that wording specifically because with you, I am 100% with you. I don't want our approach to be taken as mandatory testing and treatment will solve the epidemic. That would be highly unethical, highly problematic, and counterproductive.
Take it.